This presentation is on borderline personality disorder. Borderline personality disorder, also known as BPD, is a pattern of instability in personal relationships, intense emotions, poor self-image, and impulsivity. A person with BPD may also go great lengths to avoid being abandoned, have repeated suicide attempts, display inappropriate intense anger, or have ongoing feelings of emptiness. Symptoms include fear of abandonment, unstable relationships, unclear or shifting self-image, impulsive, self-destructive behaviors, self-harm, extreme emotional swings, chronic feelings of emptiness, explosive anger, and feeling suspicious or out of touch with reality. The symptoms that apply to Harley Quinn include unstable relationships, like the one with the Joker, explosive anger, like killing people for fun, impulsive self-destructive behaviors, also an example is killing people for fun, and extreme emotional swings, like when she's happy and then all of a sudden becomes mad. Psychotherapy is the treatment of mental disorders psychologically, like talk therapy, rather than medical therapy. Dialectical behavior therapy is a specific type of CBT that helps regulate emotions. It is often used to treat people with chronic suicidal thoughts, people with borderline personality disorder, eating disorders, and PTSD. It teaches new skills to help people take personal responsibility to change unhealthy or disruptive behavior. It involves both individual and group therapy. With this method, Quinn would see a therapist once a week for 1 to 3 years to talk about different ways to cope with her everyday life activities and also how to control her anger and impulsive behaviors. Advantages include her learning how to control her actions, keep more stable relationships, and become an overall better person. Disadvantages include the therapy being very expensive and it is also a very long process. Biomedical therapy is the treatment of mental disorders by drug therapy, electroconvulsive or shock treatment, and psychosurgery rather than psychological. Electroconvulsive therapy, or ETC, is medical treatment most commonly used in patients with severe major depression or personality disorder that has not responded to other treatments. This method would require Quinn to get through treatments 3 times a week for 2 to 4 weeks. This is where the doctor will connect stimulus electrodes that produce a shock to the brain that lasts from around 30 seconds to 2 minutes. After, the doctor will prescribe her with an antidepressant to reduce the chance of relapse. Advantages include an increase in her overall happiness and more immediate impact. Disadvantages is post-treatment confusion and persistent memory loss. And this is my works cited page.